A beautiful smile can brighten your day. Now you can have that smile you've always wanted and much more. All thanks to revolutionary and high-tech treatments at Cambridge Family Dentistry, located in Wichita, Kansas. Hi, I'm JW. Are you suffering from pain, missing teeth, ill-fitting dentures, or the embarrassment of not chewing or smiling like you want to? Well, in a moment, I'll be speaking with Dr. Dean Wright of Cambridge Family Dentistry about how you can change your life with the truly incredible advancements in dental implants. These amazing and affordable procedures will have you smiling, chewing, and getting your life back to normal again. Cambridge Family Dentistry is one of the largest implant and general dentistry clinics in the United States, with 20 treatment rooms, 2 sterilization labs, 3-dimensional x-rays, and all of the latest advanced technology in the field of dentistry. A team of 5 doctors is joined by a highly trained supporting staff that will ensure you receive the finest in dental care. When we return, I'll be speaking with Dr. Wright about all of the new and exciting things that Cambridge Family Dentistry can help you with.
What you're about to see will amaze you. This man is wearing dentures with no messy pastes, no adhesives whatsoever. The revolutionary 3M denture attachment system. Dentures snap out, they snap in, they stay put. The system is not recommended for everyone, and the required medical procedure carries potential risks. To determine whether this is right for you, set up a free consultation.
Over 16,000 implants, including this one. Cambridge Family Dentistry in Wichita.
For years, I went to my own private dentist and an orthodontist because I had a periodontal disease. And for years, I just kept paying the money out, and my teeth kept getting worse and worse, but there wasn't anything anybody could do about it. But I got fed up with it, and I seen Dr. Wright on Sunday morning advertisements on television, and I said about the second or third time that I witnessed that commercial, I said, I gotta go talk to these people. And I made my appointment. 2 to 3 weeks later, they had me in here, and one day I was in with 15 implants and out the same day. And just love it. Just tired of not being able to go out and eat. I was very embarrassed to smile. It was always a problem opening your mouth, and who was going to see it? Now I just don't want to shut up. So it keeps rolling out. But I'm so happy with it. Taking pictures of my teeth with my cell phone and sending them to all my friends. But again, I would not recommend this to anybody. Only if you want to have nice teeth and have the best place in the country to have it done, this is the place to come.
Welcome back. Dr. Dean Wright has practiced dentistry for 40 years. He is a graduate of Wichita State University and University of Missouri, Kansas City Dental School. He started placing dental implants in 1976. Dr. Wright has lectured nationwide and trained other dentists. He has also had articles published in professional journals about dental implants. Over the past 4 decades, Dr. Wright has been privileged to do advanced studies in the field of dental implantology at UCLA, University of Oklahoma, Houston, Boston, New York, and even internationally. Having personally placed and restored over 16,000 dental implants, Dr. Wright is ready to share and update his expertise and feelings about the future of high-tech dentistry and how it can help everyone. Welcome, Dr. Wright. Wow, you must be exhausted after 40 years and 16,000 implants?
Well, everybody does get tired from time to time, and we've put in a lot of effort and a lot of work, but I'm more excited and enthusiastic about the future of dentistry than I've ever been before, and what we can do for people with regular dentistry and dental implants.
Yeah, we did an interview a couple years ago.
Yes.
And I'm just kind of curious if anything has changed, and what are some of the new ideas that you're bringing to the table today?
Well, I wanted to come back and do this again and update people, because I feel like there's a lot of confusion about implants and regular dentistry, and one should be used over the other. We're finding out that half the time when people come in for an implant consult, we wind up just doing regular dentistry, maybe regular crowns, bridges, dentures, whatever. But the other half the time, sure, they need implants or something more advanced, and we're able to do that too.
That's great. So it's not like you're saying this is the answer to everything.
Right.
Right. Well, let's just talk about the basics. What is a dental implant?
A dental implant is a titanium alloyed metal screw or cylinder that is inserted into the bone. Most of the time it has a special coating, we just call it HA, and that coating is liked very much by the bone, and the bone will integrate and fuse to it and make it very strong over time. And then we can hook onto that tooth, put a crown, a bridge, hook up a partial, hook up dentures, just do a lot of things. So it's actually like putting back a tooth or a root where a person is missing one.
When we come back, we'll talk about the different types of implants.
Dr. V was very kind and worked with me and was all upfront about everything they were going to do and what it was going to cost. I was kind of scared because I don't like shots. Nothing hurt. Nothing. She got done and she showed me what she did and she put my teeth in and I was like, wow. So I was really excited when we came back up for the checkup. I'm like, okay, yeah, I know it's only been 2 weeks, but let's schedule the uppers too. And now I can open my mouth and eat, and I can eat steak. So I'm happy. After the second set got done, I went to my daughter's house and she started bawling. She's like, Mama, you look like yourself again. You look like my mama. And that was worth everything to me. I love these people. You walk in, you feel like they're your family. They genuinely care about you. They listen to everything you say. Go to where they're experienced. They do it right the first time. You'll walk out with no regrets. Don't let somebody else tell you they can do it. Research it well. That's Cambridge, all rolled up into one. They know exactly what they're doing.
One thing I've learned as a mom, the need for a good dentist and a dental office with convenient hours can be hard to find.
Mom, Cody fell off the bed.
Another reason our family loves Cambridge Family Dentistry. They offer same-day emergency service. In fact, we always get quick appointment times at Cambridge. They're even open on Fridays. Oh, and you'll love this. New patients and second opinions receive a free consultation. It's true. At Cambridge Family Dentistry in Wichita, you have something to smile about.
We're back with Dr. Wright. So tell me, what are the different kinds of implants?
Well, basically, I'm going to show two types today. When we did this, what was it, 7 or 8 years ago, we were very heavily into the mini implants, and we still do that as one of our preferred choices. The mini implant is a small implant. It's more like a little screw, and it goes down into the bone. It's a one-stage implant, which means it can be put in and hooked up the same day. So a patient like this would come in with a very loose denture, and then we can put the implants down in there, make a change into the bottom of the plate here, reline it, do a snap system, and then lock it down all in one day. So this is really a very effective way to hook up dentures. People really, really enjoy this and like it. It's a life-changing experience is what it is.
Okay.
Also, you can do it on the upper. A lot of people have a gagging problem. So if the denture goes way back and they gag on that and they don't like the loss of taste and all, we can place these same implants into the upper and hook onto that. And now we're nice and snug again.
Wow.
So between the two, we can take a full set of dentures and hook those up very well and make it very strong, very tight. And it's, like I said, quick, easy, and very cost-effective too.
And
now,
so those are called the mini dental.
yeah, this is a mini implant because by definition, it has to be less than 3 millimeters in diameter. So they go anywhere from about 1.8 millimeters to 2.9 millimeters. Now, everybody doesn't have the same kind of bone. We're all different. And I could see years ago that we needed something else besides just the minis. We needed something short and rather fat or bulbous. And so I researched and looked around, and I found a new company in Boston called Bicon. and they make a short, fat type implant. And actually, this is a picture of it.
Oh.
It looks like a little hand grenade. It has louvers. That's not really a screw, but it has louvers. And a small opening's made in the bone. The implant is inserted. After 3 months, the bone grows into that. Then we go back and we can pop in what we call the abutment, the upper part there, and go ahead and just treat it like a regular tooth and then put on a crown. Okay? Now, you can also hook up dentures with this, but in many cases, the mini implants are sufficient to do that. This is a little more time consuming, it runs a little more money, but for the people that don't have the proper bone, my goodness, it works.
Sure, sure.
And one more picture of a tooth. This is probably a little upper there. Implant in place, abutment, and then the crown and everything.
So the second implant that you're showing me is not only for like a full set of dentures, but if you just need to go in and do 1 or 2 teeth,
Right.
you can utilize this one. But the main reason for the second one is due to the density of the bone.
Yes, and the size of the bone.
Okay.
Long, narrow bone can get a long, narrow implant. Shorter, fatter, less bone can get a smaller implant. This is another example here. Once that bicon is put down in there, then a single crown could be put on there. But also in the back, you could put a couple and do a bridge.
I see.
And so, you know, you could set several teeth across there as one unit and lock it into place. So just a lot of versatility, but between these two, we can literally do 99.9% of just about everybody.
Wow.
In fact, I've got a couple stories to tell you. I had a lady come in, and she was an elderly lady, and she'd wore dentures for so long that her mandible was down to 3 millimeters. That's about that big,
Okay.
maybe less than 1/4 of an inch. And she'd been to 6 different offices, some of them specialists, and nobody could help her. And somehow she saw us on TV and she came in and I said, my goodness, I've never seen such small bone, but I'm willing to try because the mini implant actually comes in one size that is not much bigger than that, and we're going to do it. So we went ahead and fixed her and hooked her up, and we're going to show you some pictures of that.
Great.
The before, the after, and the only funny thing about it is she's pretty spunky, and so she turned around and went back to all 6 of those offices.
Oh,
that
she did?
Yeah, she chastised them, and she let them have it for not knowing
Isn't
how to
that
do that
fun?
procedure.
Good for her. Well,
Yeah.
good for her. Well, is it true that you have placed more mini dental implants than anyone in North America?
That's what they tell me.
Yeah.
The
That's
manufacturers,
impressive.
when
Very impressive.
they look at what the orders have been and the amount that have placed and all, they say we've done more than anybody, so
Wow.
I guess we'll take the credit.
Right. Yeah.
But a lot of that is just due to the fact that people have trusted us, they have liked what we're able to offer, and I tell you, we're going to work as hard as we can to make people happy,
Yeah.
and then hopefully they'll go tell others that are in need of our services and so on.
In your experience, it just speaks volumes, you know, it really does. So those numbers do matter, they really do. You know, we've been talking about the patient and the importance of you putting them at ease and also giving them all these options. There's other benefits as well, I know. Would you share those with us?
Sure. Let's think about that a second. The person that has lost teeth, they can't smile, they're in pain, they can't chew, their life has been changed. And this is something we use every day, 24/7. So what's the benefit? Wow. Well, if somebody gets their mouth fixed and they have tight teeth and they can chew better, they can smile, they can laugh, they can eat in a restaurant and not have to excuse themselves catching food underneath their denture. It's a life-changing thing, and it's just wonderful when people go through this process, because we're going to take them from maybe what could be considered a dental disaster to a dental success.
And getting their life back to normal, you know, what they once knew.
Exactly. It's, you know, getting back to normal. That's what it's all about.
Life-changing, that to me says it all.
Well, I hear that from patients all the time. You know, you've changed my life. Sometimes they cry.
Yeah.
We get a lot of hugs in our office.
bet.
Yeah, and that's
I'll bet.
nice, you know, because
Yeah.
you can tell people are grateful. And of course, we're very happy to take care of them.
Now, where and why are implants needed?
This is where the confusion lies. And one of the main reasons I wanted to clarify some misconceptions I've seen. Just because you have a space in your mouth where you're missing teeth does not mean that you have to have implants. Many times, just regular dentistry will be sufficient or even better. And by that I mean, let's say for instance, a person comes into my office and they're missing a tooth. Well, if the two teeth on either side have large fillings or crowns already or problems or decay or whatever, wouldn't that be smarter to just put like a regular bridge in there? Because if you do the bridge with 3 teeth, you're going to crown the 2 bad teeth on either side plus fill in the space. Well, that's going to cost a little less than if you'd done the 1 implant and you're getting more for your money. But let's say, for instance, a person comes in and they got that space and the 2 teeth on either side are just perfect. Well, that might be a good time to do the implant because it's not going to have to, we're not going to have to cut away on the other teeth on either side and do crowns, bridges, or whatever. So I see a lot of that. And people come to our office for second opinions, which we give complimentary. We're glad to just tell it like it is because we see both sides of this.
Sure.
You know, we do the regular general dentistry, we do a lot of implants, but we can guide them in the direction we think is most effective, unless they've decided to do it one way or another themselves.
Sure.
So once again, just because you think you need an implant, it may not be the exact thing to do. There's a misconception too about hooking the dentures to the mini implants. I think some people think that they always have to have a new denture, and that's not true.
Oh.
Almost every time we can take their existing denture
Really?
if it's satisfactory to them, and we can attach it to implants and they don't have to have a brand new denture
Now,
made.
see, that was my assumption.
To give an example of what we see sometimes, once again in the past year I had a lady come into our office and she'd been diagnosed with $40,000 worth of bone grafting and implants up through the top of her face towards the back here. Well, that's a big investment. That would be pretty painful, a lot of surgery and a lot of time. Plus, she just didn't have that kind of money to throw around, and it would have been kind of tough on her because she was a little older. So we looked at the situation, and like I told her, I said, if you'd come to our office and not even seen somebody else, I would have diagnosed a bridge there first because she had good support. The teeth around it needed crowning. We went up there and just did a regular bridge. It cost $3,900. That's a little less than 10% of what she would have spent.
Sure.
And she walked out of our office, of course, very happy. And we were pleased to do that for her because it was the right thing to do.
You know, when we come back, we're going to talk more about Cambridge Family Dentistry. So don't go away.
At Cambridge Family Dentistry, you have something to smile about. So if you have missing teeth or dentures that don't fit right, let Cambridge Family Dentistry introduce you to dental implants. This virtually painless procedure will have you looking great and living with confidence. Cambridge offers easy payment plans too. Cambridge Family Dentistry is the state's original mini dental implant clinic. Call or go online to learn more about the difference a dental implant can make in your life. Cambridge Family Dentistry, you have something to smile about.
I had good dentures, they were good, my mouth was the right shape for it, they fit well, but it just couldn't eat anything. I couldn't chew an apple, I couldn't bite a pickle, nothing was very white, I couldn't chop down on it, they would flip up. And all the adhesives in the world didn't help. My wife got tired of hearing me complain, and we saw the Cambridge ad, and we thought, we'll go by and look. And I came, they x-rayed my head, my mouth, my tooth structure, and said, you're a perfect candidate. And I said, let's do it. So I was apprehensive about the feel and the pain, and I came in at 8 o'clock in the morning. They put those pins in my upper teeth, came back at 4 o'clock, and they put the bridge in, and it was great. And then in 3 or 4 years later, I had the bottom ones put in. And that was really the godsend when they were all put in. They just made it perfect. I didn't stutter when I talked. I didn't have to talk like this or to keep them from falling out or moving. It just was natural. You know, I used to have to slice apples and slice pickles, and now I can get a Clausen kosher dill and just eat the whole thing just by chewing on it. Well, they're friendly, everybody knows you. I walk in the door and they say, hi Bob, we got an appointment today? And it's like they've known me all my life. So it's a good place, it really is. It's clean, well kept, and Dr. Wright's a hoot. He's fun to be with.
What makes your clinic, Cambridge Family Dentistry, unique and different from the other dentist offices in town?
We are general dentists, and there's 5 of us, but we see both sides of the dental problems. In other words, if you came to my clinic and you had a problem, if you need an implant, we can see that you need the implant, we could diagnose that. But if you need traditional regular dentistry that would be simpler, easier, and not as expensive, sure, we can do that too. Now, if you went to just a clinic that did nothing but implants, what do you think you're going to get?
Exactly, exactly.
And if you went to a clinic that does nothing but just routine dentistry, what are you going to get? Okay,
yeah.
but since we see both sides of it, that works very well for the patient.
I think that is just essential for the patient, you know, to be comfortable and know that they can come to one place and get the right guidance and get the right care.
That's an important point because so many patients wind up getting the group effect. In other words, they'll go to Dr. A and then Dr. B and then Dr. C to try to get everything done. If you come to our clinic, we're A to Z. We're going to start you, we're going to finish you, we're going to do everything in between. A lot of people have had their teeth removed. They've had to wear the dentures for maybe 6 months or a year and then get the implants. I didn't like that concept. I thought that was too rough, it was too time consuming. I didn't want the people to go that long without implants. So we developed a technique where the patient can come in, we remove the bad teeth, we place the implants the same day, we modify the denture, put in the snaps, and at the end of the day, we actually hook it up and it's just one day.
That's amazing.
And if they feel like it, they can go back to work the next day. The patient comes from out of town, or if they're too embarrassed to leave, if we're working on their teeth and they need to stay for the day, let's say we're sending their teeth off to the lab and it's going to come back later in the day, we can make them comfortable, they can stay in a private room, they don't have to leave, and that's a nice thing too. Implants work between 95 and 98% of the time, so they're highly successful. But when you've placed 16,000, a few may not work.
Sure.
Okay, but we're going to stand behind that, we're going to guarantee a result.
Right. So Dr. Wright, tell me more about Cambridge Family Dentistry.
You know, we built the clinic in 2000, and we had about 12 operatories, and we needed to expand, and so in the last few years we moved that up to 20. So we have about 20 operatories with the 5 doctors. We also have a three-dimensional x-ray machine where we can actually look at the bone in all dimensions and measure it down, you know, to just fractions of a millimeter, which is very, very good tool. We also have 2 sterilization areas. We have 2 laboratories.
The initial exam is free. Can you give me an idea what the costs of dental implants are, if that's the direction that you would guide them?
Sure. If a person will just call in, they make an appointment, we will give that complimentary exam and try to explain everything they need, give them options, and just find out if there's something we can do for them. Because it's just impossible to do that over the phone. Everybody's needs are different. Every case is unique, and it's just something that we have to do, so it's better to do that.
Now, there are some people that are very reluctant to go to the dentist. So what do you do to make your patients feel more at ease?
Okay. I'm not going to pull any punches on this. Going to the dentist can be a fearful thing.
Yes.
You know, there's a lot of people that have had a bad experience, or they've been treated rudely or improperly, or they thought maybe they got hurt or whatever. So we're going to do everything we can to make that appointment as nice as possible. We can go all the way from the hardcore person that wants to use nothing, which is never, or a local, or some sedatives, or go all the way into a sedation, sleeping
That's
type
wonderful.
process.
Yeah, because it's essential that the patient is comfortable. They need to be at ease.
Right,
They
and once
truly
again,
do.
everybody has different needs, and we're going to meet that need.
That's great. A lot of valuable information, folks. Really. Come see us at Cambridge Family Dentistry. Thank you, Dr. Wright.
You're welcome. Thank you.
Having dentures never felt like they were a part of me, nor did they ever feel like they were very natural. The floating, not being able to eat everything I wanted to eat, nuts, you know, chew things that were hard, those were the things that were very difficult when you have dentures. I saw Dr. Wright's infomercial on television, And I thought, well, that's the thing for me. I was very intrigued and decided I would make an appointment and check it out. The one thing that surprised me was they all tell you, oh, it doesn't hurt, but don't ever believe them. But you know, when I had the mini dental implants, it really didn't hurt. I was surprised at that. Actually, the cost in retrospect, I would have paid double for how much good it has done me. It was 2 hours from start to finish. After they numbed me, you know, of course the pain is gone at that point, and I had 6 implants put in like 2 hours. And after the implants were put in, I actually drove myself home and only used over-the-counter medication for what little discomfort that I had. When you sit down to eat in a restaurant, you think, oh, I can't eat that or that, and then one day you think, I can now. This is wonderful. Now I can eat these things and feel more at ease and not have the floating dentures and don't have to get up to go clean your teeth in the restaurant. You know, they just feel like they're a part of me now. And so you just feel more confident. Many dental implants are incredible. I would do it again in a heartbeat for twice the price, but don't tell Dr. Wright.
What you're about to see will amaze you. This man is wearing dentures with no messy pastes, no adhesives whatsoever. The revolutionary 3M denture attachment system. Dentures snap out, they snap in, they stay put. The system is not recommended for everyone, and the required medical procedure carries potential risks. To determine whether this is right for you, set up a free consultation.
Over 16,000 implants, including this one. Cambridge Family Dentistry in Wichita.
Welcome back. If you or a family member or friend is suffering from a missing tooth or multiple teeth or ill-fitting dentures, you really should call Cambridge Family Dentistry. They always offer a free consultation, so call the toll-free number on your screen now. Dental implants can make life so much easier by helping you eat, talk, and smile better. And as you've heard today, so many other benefits await you. We'd like to thank Dr. Wright for joining us today. This has truly been valuable information about the exciting advancements in the world of dentistry and dental implants. We also hope you will call the toll-free number right now to take advantage of the complimentary examination to see if dental implants are right for you. Of course, Cambridge Family Dentistry is a lot more than just implants. The staff of doctors has performed millions of procedures. For your general dentistry needs, Cambridge should be your choice for the entire family. They offer quick appointments, they can handle daily emergencies, and are open on Fridays for your convenience. And personalized care makes Cambridge the perfect dental clinic for anyone in your family. If you would like to find out more, please feel free to visit their website at cambridgefamilydentists.com. Thanks again for joining us. I'm JW, and we'll see you next time.